Hi guys, welcome back to Alpha Physiopelvic Care. My name is Anastasia Varova and I'm practicing pelvic floor physiotherapist here in sunny Cyprus. Today I would like to talk about pessaries. And when I mention pessary, of course, the first question is, what is it? So today I would like to briefly introduce you to the concept of pessaries. What does it do? I will not go through all the shapes and various types of pessaries because it's very major topic and vast topic, but the main point, how pessary can help you, the plus and the minus of the pessaries, and if you can be a suitable candidate for it, or maybe this is something that might not be for you. So let's start with what is a pessary. Pessary basically is a device that is placed into vagina in order to provide you support for your inner organs if you suffer from prolapse. If you suffer from pelvic organ prolapse, it can be either uterine prolapse, it can be bladder prolapse, it can be bowel prolapse, it can be all three and any combination of all of those. It can be vaginal bowel prolapse if you had hysterectomy and your uterus was removed. So when the tube of vagina drops down, it can be also that. So what is the point of the pessary? The pessary, I have here my imaginary vagina as a glass and a pessary. Of course, remember, our vaginas are much more stretchier and pliable than the glass. So the point of the pessary is to go inside of your vagina and to provide support. Okay, so if this is a ring vagina, a ring pessary, it goes inside and it sits there and provides support to the organs so that they don't move down and you feel more comfortable doing your daily living activities. Now there are two main type of pessaries. Pessaries that provide support like this one, and usually it will be in the shape of the ring, or pessaries that fill up the space of the vagina so organs cannot actually take that space and drop into that space. This, for example, is a cube pessary. As you can see, it takes the space inside the vagina so the organs don't fall inside. So these are two types of pessaries. Of course, these days there are different shapes and sizes. There are different materials. They can be silicone, they can be PVC, they can be natural sponge pessaries, they can be inflatable pessaries. So all that great variety, but the point is the same: to provide support and to occupy the space of vagina so nothing else drops there, depending on what you need. One thing I would like to mention is that pessaries do not treat pelvic organ prolapse as such. The job of pelvic floor of the pessaries is to provide support for the organs, but if you use them, you feel better and you then remove them, symptoms usually return unless there has been a natural resolution or you've been going through a rehab process and things have improved. But pessary is not used as a treatment device, it's used as a symptom management device. Now, who would be a good generally candidate for a pessary? Now, always individual assessment. I urge you not to self-prescribe pessaries, not to buy them randomly online and try them in and out, because it's not only about not getting the right size and shape, it's about making sure that you're a right candidate, that you are healthy and your tissues are healthy to have a foreign body inside in your body, in your vagina. Okay, this is also a very important bit. So who would benefit from the pessaries? I would always start with the simple things. If people suffer from pelvic organ prolapse, we always start with rehabilitation, with exercises, lifestyle adjustment, breathing, diet, and so on. Not all of these things are prescribed by me, such as diet, for example, but we work in conjunction with different professionals. Now, if this doesn't help and the person wants to do XYZ activities, running, jumping, swimming, dancing, for example, I offer pessary. especially if woman is not willing to go through operation right now and she's completely against it for time being. Yes, there are times when operation is really a solution, but we go from the simple to most complicated. So if you don't suffer, first of all, you must be able to insert and remove pessary. Okay. Regarding of your overall health, that we of course also assess, if you are willing and able to insert and remove pessary yourself, you can be a good candidate, and we proceed to the further assessment. We see how healthy is your vaginal tissues. Do you need maybe extra treatment with estrogen, for example, if you are perimenopausal/menopausal, or maybe you generally need that kind of treatment to make sure you don't have any acute conditions. So the area is basically prepared for having a foreign body, and there is no or very, very minimal chances of irritation, and definitely nothing acute going on. Sometimes I get patients who are really willing to try, but for that point of time, and it doesn't mean it can't change, but that point of time, they are simply unable. I'm unable to get the pessary inside. I give it to them to try. They can't. Maybe their pelvic floor is in spasm. Maybe there is a lot of stress going on. They just can't get it in and get it through. Of course, we will not force it, and maybe we will try to do some pelvic floor release work and try again, depending on what patients want. If you are an athlete, recreational professional, pessary can be a great support for you if you find the right one. And that's also a bit of a downside of the pessary. Rarely you get it right from the first time, unfortunately. Sometimes it is a matter of trial and error. No matter how well the fitting went, no matter how well you felt in fitting, but when you wear it, you undergo different kind of stress. You can do different exercises than the one that we tried, movements in the fitting. You work through the day, you've been upright, so it's a different stress that your body and the pessary subsequently undergoes. All right. Also, I mentioned the insertion. So if you can insert it itself, usually I do teach people to remove the pessary, especially if it's a space filling pessary. It has to be removed nightly. All right. The one that fills up the space of vagina, it's either used for a day, removed for the night, or it's only used for a certain event that you might need extra support, such as running, let's say, a marathon. Ring pessaries can stay inside for longer. Usually it's up to 3 months, whatever manufacturer stays, because there is an opening where the vaginal discharge can come up freely. However, I'd rather always prefer that my clients are able to get the pessary out. And if they really struggle to get it out, of course, I can get it out for them. But different circumstances can happen. They might travel, they might move, they can't come to me right at that moment. So I make sure my clients are able to remove pessary, and they can do it, comfortable enough. After that, a woman can take decision if she wants to go through the process of taking it in, taking it out daily, if it's a space filling one, or at least in 6 weeks for the first time to check on the pessary, and then every 3 months if it's a ring type of pessary. So a willingness to insert, to remove it yourself, so the maintenance of the pessary, and then the washing is quite easy. So if a woman, as I mentioned, the operation. Now, pregnancy, you can use pessary in pregnancy for support. However, usually with these clients, I either let the gynecologist do it, or we really work close with OBGYN. So decision has to be taken together with OBGYN, and of course they have to be aware on that you are using pessary in a pregnant person, and you have to work in a team if this happens. Now, who is probably not the first candidate for a pessary? However, I say never. Sometimes people come back and they want to give it a second chance. So again, if somebody cannot insert or remove it themselves, for me, it probably would be a no-go. Somebody who has any type of recurrent infections, chronic infections, because the biomaterial, it will sit on a pessary, and we will not know how it will react if it accumulates there. So yeah, if you get once in a year a bit of a yeast infection, that's not a problem. But if you do have a serious infection, or if you have serious issues with your cervix, or anything that again OBGYN considers that can be irritated, it's a no-go. If you have ulcers, if you have any bleedings, and so on, probably not good candidate at that point. Now, if the problem will be sorted, then it's fine. Also, as I said, because pessary is trial and error, you need to see how it makes you feel. It shouldn't make you feel in pain. It shouldn't make you feel more uncomfortable. We're using the pessary to reduce discomfort, not increase discomfort. It definitely should not obstruct your toilet going, your bowel movement, your bladder movement. If it does so, whether change the pessary, you try different sizes, you try different shapes. It should not obstruct any of these processes. It's very, very important, because we don't want to make damage and to treat other things. We're trying to help you with your prolapse. Right, so these are the main things about the pessaries. Always individual. Really, really needs to be fully assessed what you're looking for from the pessary, what you're looking for rehab-wise. I would always suggest to consult a person suitable for pessaries fittings who has experience. You can ask your question down. As I said, try not to just go on the internet and get these pessaries and just try them, you know, one after another, because when the pessaries fitting measurements is done, the fitting rings or fitting type of pessaries that get sterilized are tried on you, and this is the right way to do, not just to eyeball it. Try to get you up, to get you moving a little bit, maybe do a couple of movements, see if pessary stays there, if it falls out, if it gives you any major discomfort. Discomfort is in the beginning is okay. So guys, let me know if you want to know something more specific. So I gave you just kind of very overall brief introduction, so you understand what is it, where it goes, and what's the point of it. If you would like me to talk about specific, maybe about type of pessaries, maybe how to take care of it, maybe tips and tricks removing and inserting the pessary, let me know in the comments. Let me know if you use pessary, what type of pessary it is, how it helps you with your symptoms. I will be really, really happy to hear about your experience. Thank you for watching, and we will see you very, very soon. Bye.